Well, Netcare says headline earnings hit double digits over the period despite rising operational costs. One of the country's largest private healthcare providers says revenue jumped by nearly 10% to 23.7 billion rand. Overall, normalized operating profit improved by 23.9% to 2.8 billion. Netcare says average load shedding was at around level 3 for the year, which kept the costs quite high. To break down these numbers, we're joined by Netcare CEO, Dr. Richard Friedland. Dr. Friedland, you've characterized these particular numbers as the best you've reported post-COVID. What led to the surge in earnings over the period?
Well, we've seen a return of volumes to our hospitals and to mental health. And over the last 6 months, our volumes, both in the hospital division and Akeso mental facilities, have been higher than they were in the pre-COVID period. However, this is against the background of massive hyperinflationary costs, the failure of the grid, and the highest interest rates we've seen in 14 years. So we have relied on operational efficiencies to achieve these numbers, which we did. We achieved 104 million rand in operational efficiencies from digitization alone. We also run the largest environmental sustainability program in the country in the healthcare sector, in fact, on the African continent. And we have reduced our energy footprint by some 39%. So we were able to hedge the enormous cost of electricity through efficiency savings there. And then there were a myriad of other initiatives that contributed to these excellent results.
The digitization helped you offset the cost on load shedding, but the cost of keeping those lights on and those vital machines that you have at the hospital during load shedding, how much did it set you back?
124 million rand was the cost of diesel versus 37 million rand last year and 9 million rand, Motheo, the year before. So you work that out in terms of the enormous cost. And adding insult to injury, every kilowatt hour of energy you produce from diesel costs you 3.5 times what it would cost you through Eskom. So an enormous cost burden to us.
South Africa is also looking at a looming crisis with the logistics failures we're seeing. Are you worried at all by Transnet's logistics failures, given that you could be importing machines, medicines, or other equipment to your hospitals?
Yes, absolutely. I think service delivery across South Africa is at a critical junction. It continues to deteriorate on a daily basis. And notwithstanding the assurances given by various ministers and departments, we're yet to see any meaningful improvement in any of these areas. And I think service delivery is a huge crisis in our country at the moment and impacts an organization like ours that stays open 365 days of a year, 24/7. So we rely very heavily on municipal infrastructure and service delivery.
Now, you've been able to streamline your operation in order to make some savings, but how is this hitting your reserves in terms of spending on capital to make sure that you have backup power, to make sure there are other means of getting your medicines and machines in?
Well, we run the largest solar power program in the country across the healthcare sector. Some 72 of our sites have solar energy. We signed a landmark breaking transaction for wind power at 6 of our sites, which will become effective in 2026. It's called grid wheeling, and that will increase our renewable energy to 26%. We're aiming to expand that to another 12 to 15 sites that will give us 40% renewable energy. We've got huge plans around water and making ourselves independent of water supply. And obviously we want to reduce all waste to landfill. So we're working very hard behind the scenes to increase our independence from municipal and government service delivery departments.
Dr. Friedland, your business is a people-centered business, people coming through to your operations to get medical services. How are you finding the consumer in South Africa at this particular moment? Are people delaying large operations, for instance, to try and save up enough money to go to your hospitals?
I think it's an excellent question. I think given the collapse and the challenges you're seeing within the public sector, and I'm sorry to be as blatant and as frank as that, people are clinging on to their medical aids. And so you would have argued that during COVID that was critical, but we're still seeing people retaining medical aid membership. Now, many of them can't afford the comprehensive model, so they're buying down because disposable income is at a premium and it's getting worse. And so we've introduced something known as comprehensive gap cover. We're saying to people, by all means, buy a cheaper medical scheme. It may preclude you from coming to Netcare. However, you can buy our Netcare gap cover for a couple of R100 and you can have access to the finest care. We don't believe in reducing the cost of healthcare that people have to go to old shipping containers. We want people to have access to Netcare at the same level and quality that other patients who have ordinary medical aid have. And so we're acutely aware of the crisis that South Africans are facing in an environment where there's no job creation, where we're seeing a collapse of infrastructure, and we're seeing interest rates, unfortunately, at a 14-year high.
Well, the last time we spoke around May, you flagged something else that could affect the industry, the acute shortage of nursing staff. Have you been able to improve that capacity in your own operations?
Well, we're slowly working and making progress with the National Department of Health and the South African Nursing Council. There's a new council in place, and we're making slow progress. But we'd like to be able to put that on steroids because there is an enormous shortage of nurses, some 89,000 in our country. And whether we're delivering NHI or universal health care, whether we're delivering care in the public or private sector, there is a critical shortage of nurses, and care is not able to be delivered by robots. We need our nurses on the front line.
Dr. Friedland, you due to retire next year, going into early retirement. Has Netcare bagged a new CEO? And how tough has it been to try and find someone with you having been at the helm for close to 20 years?
Yeah, I'm not part of that process. The board and the nominations committee has run that process. An external candidate has been identified. That candidate is not available in the immediate near term, and so I will be extending my retirement from September 2024 to March 2025 in order to effect a stable and sustainable handover.
Thank you very much for having this conversation with us, the CEO at Netcare, Dr. Richard Friedland.